Good afternoon. My name is Joanna, and today I'm going to talk to you about the QI plan in Chapel Regional Hospital. There are different quality methods within the healthcare. Quality improvement in healthcare can help you improve your health services for individuals and populations to increase the desired health outcomes with reduced costs. Quality improvement can lead to measurable improvements in healthcare. Quality improvement efforts should be transparent to your staff, physicians, and patients. Include the entire practice team and patients when planning and implementing QI projects, and communicate your project needs, priority, actions, and results to everyone, including your patients. The basic models that you can use for quality improvement. Quality improvement defines how things are done, while quality in the healthcare defines the performance by the efficiency of the organizations and the results of care, even the level of the satisfaction of the patients. Lean Six Sigma is an approach to quality improvement that blends two separate, already well-established methodologies, Lean and Six Sigma. Lean Six Sigma features 5 steps to address a problem, which are define, measure, analyze, improve, and control. The Lean Six Sigma methodology provides a structured approach in eliminating causes of common problems encountered in the healthcare facility. It also fosters teamwork and involvement of the different departments and disciplines in the healthcare facility. It helps improve process flow, eliminate waste, decrease process variation, and overall helps improve outcomes, which will ultimately improve the patient's care. Why we evaluate the role and importance of the patient satisfaction. Measuring customer satisfaction is usually about measuring the quality. The higher quality care received is typically reflected in the higher levels of satisfaction. Patient satisfaction surveys, when done well, provide excellent information on care and can be used to develop change initiatives. Surveys are about improving the quality of treatment while maintaining the financial profitability of the facility. Why we evaluate the role and importance of the patient experience. The patient experience encompasses the range of interactions that patients have with the healthcare system, including the care from the health plans, from the doctors, from the nurses, and the staff in the hospital, the physician practices, and other healthcare facilities. As an integral component of healthcare quality, patient experience includes several aspects of healthcare delivery that the patients value highly when they seek and receive care, such as getting timely appointments, easy access to information, good communications with the healthcare provider. Understanding the patient experience is a key step in moving toward patient-centered care. By looking at various aspects of patient experience, one can assess the extent to which patients are receiving care that is respectful of and responsive to the individual patient preferences, needs, and values. Evaluating patient experience along with other components, such as the effectiveness and the safety of care, is essential to providing a complete picture of the healthcare quality. So let's take a look at how a survey should be done and the topics you should always cover. You can ask them to rate the questions from a 1 to 5, 1 being the less, 5 being the greatest. You can ask questions like, were they satisfied with the comfort of their room, the beds, the towels, etc. provided by the facility? Their overall stay, were they satisfied with the overall care during their stay? Did they feel their needs were being met? Were they satisfied with the activities being provided? Sometimes this can go over PT, OT, the speech, the helping them with their motor, with the feeding, with the walking. How satisfied were they with the response time of the call bell if the physicians came in on time? You can ask questions of how satisfied did the provider explain their medical needs, how satisfied were they with the dietary plan, how satisfied were they with the explanation of the treatment plan during their stay, the explanation of the billing process, were they satisfied with the treatment from the nurses. Another thing you can always ask is, would they recommend the facility to family members and friends? Were they satisfied with the cleanliness of the facility? These can be the cleanliness in the waiting room, in the room. Was it cluttered? Did the physicians wash their hands? They sanitized their hands going in and out? Was the linen clean? How often were their beds being changed? Remember to always leave a sections where they can ask questions, their comments, their concerns. Sometimes the surveys don't have questions that they wish they were asked but didn't, or we forgot to cover something, and this is an area where they can ask, and we can always come back and give them the information that they are looking for. Why we implement surveys. Surveys can provide feedbacks such as the overall patient experience, which is understanding critical patients' concerns, which allows the facility to take action where needed, such as correcting inefficiency or mismanagement of resources. The survey can provide information about unreported problems that may have negative impact on other patients. Physician and employee behavior. The survey provides the facility with information on both excellent and subpar employees, allowing the facility to recognize the good ones while counseling the poor ones. The survey can give a voice to the workers, from the physician to the clerical workers, by addressing employees' concerns at all levels. The facility can move towards a better quality organization. Communication. Surveys can often pinpoint areas where communication is failing because there are many medical records errors. The results from poor communication. Improving in this area can have a positive impact on the overall of the quality. The friendliness, helpfulness, the wait time. The quality of care is often perceived by patients based on the care that is provided promptly by the clinicians with excellent bedside manners. The survey for friendliness, helpfulness, and wait time. Facilities can find areas for improvement and make changes that will have a positive impact. The cleanliness. Cleanliness is often an expectation, but the hygiene standards may not always be met. The survey can indicate employees' knowledge on hand hygiene and levels of compliance. Setting and meeting high cleanliness standards are an improvement quality measures. Billing part of the survey can uncover billing issues in any facility, and in addition, the survey can provide information on the patient's perceptions of the billing practices, such as the fairness and the clarity. The patient support survey. Surveys play an important role in providing the feedback to the facility regarding the patient's overall stay. Are there accommodations being met? Are the support services adequate? This information can allow a facility to provide a better quality. The dietary services. Proper nutrition is an essential part of the patient's rehabilitation. Food services are frequently criticized in healthcare facilities because the food is not, being brought hot. Sometimes it's being brought cold. So receiving good meals can go a long way towards improving the patient's perception. Knowing how to use this data will enable the healthcare facility to develop and implement quality improvement programs. The types of measurements that will be used within the QI plan should be a systematic process which identifies the leadership's accountability and dedicated resources. The use of the data and measurable outcomes can determine the progress towards relevant evidence-based benchmarks. Focus on the linkage, the efficiencies, and the provider and client's expectation in addressing outcome improvement. continuous process that is adaptive to change, that fits the framework with programs such as JACO, Medicaid, or other HRSAs. The data collected can provide feedback into the process to assure that our goals are being met and are accomplished. Implementing QI improvement methods. There was a hospital who was trying to decrease their pressure ulcers by 60%. So the method that they used was the Lean Six Sigma. The first thing they did was they defined the problem. They noticed that they had a hospital-wide increase in pressure ulcers. So the nurses developed a success on how to measure that, and a 20% decrease in the pressure ulcer over 12 months, I'm sorry. They then analyzed the problems and they showed the importance of educating the staff on pressure ulcers prevention. They did monthly skin meetings. They did better availability of chair pads and better pressure ulcer beds. The solution was to improve the situation, and processes were numerous and included a mandatory class on pressure ulcer prevention. Also, they did monthly meetings, frequent email updates on pressure ulcer rates for each unit. They figured out special placements on the chair pads, the relocation of the beds to make it accessible for all the departments to use these beds. The hospital sustained improvement control throughout continued pressure ulcer initiatives. The effort eventually paid off. Not only was the hospital a 60% drop, but they tripled for what they had aimed for. The following year, the pressure ulcer dropped an additional 30%. Applying statistics to define the QI methods. Statistical methods in quality improvements are defined as the use of collected data and quality standards to find new ways to improve products and services. They are formalized of a body of techniques characteristically involving attempts to interfere the properties of a large collected data. The use of the statistical methods in quality improvement takes many forms, including design and analysis of experiments, from planning, conducting, analyzing, interpreting control tests to evaluate the factors that may influence a responsive variable. So let's take a look at the statistics when we did a survey at Chaparral Regional Hospital a few weeks back. So let's take a look at the survey category of staff. When they were asked if the staff was friendly and helpful, they received the highest response in 5, with 21 out of 40 that were satisfied with the way the staff responded to them. The knowledge and professional side of it, however, scored the lowest, with 6 out of 40 who responded with a 5. That's less than 15% of the respondents left satisfied. Let's take a look at the category facility and convenience. The comfort while waiting had the highest respondents of 20 out of 40 who answered 5, which is a 50% rate left satisfied. However, the waiting time in the reception area scored the lowest, with 9 out of 40 who responded with the 5. That's less than 25% who were left satisfied. The highest score of 11 out of 40 who answered they had poor service. Quality improvement in healthcare can help you improve your health services for individuals and populations to increase the desired health outcomes with reduced costs. Quality improvement defines how things are done. Meanwhile, quality in the healthcare performance is characterized by the efficiency of an organization and the results of care, even the level of the satisfaction of the patients. The Lean Six Sigma was an approach that quality improvement can use that has 5 steps, which define, measure, analyze, improve, and control. When you're measuring customer satisfaction, it's usually about measuring the quality